If you've been fully vaccinated, do you need a booster? That's the debate going on between one big pharma company and federal officials. Pfizer spent yesterday testifying to federal health officials to press its case for a COVID-19 vaccine booster. Both the CDC and FDA have contradicted Pfizer, saying fully vaccinated Americans do not need a booster shot at this time. That's adding to an already confusing situation, and now there are concerns about a new warning that will be placed on the Johnson & Johnson vaccine. Joining us is Dr. Richard Novak with UIC. He was one of the principal investigators of a clinical trial study on vaccines early on. Good morning to you, Dr. Novak. Always a pleasure to have you. Let's start with the breaking news from yesterday and overnight. That warning on the J&J vaccine saying that in rare cases it could cause something called Guillain-Barré syndrome. What exactly is that, and how concerned should people who have already gotten the vaccine be?
So Guillain-Barré syndrome is a kind of an autoimmune disease that most often is actually seen after infections. There are a variety of infections that can cause it, and it's what we call an ascending paralysis. So it starts with weakness, usually in the feet or legs, and it can climb up the body and involve other parts. In worst case scenarios, it can cause complete paralysis, requiring somebody to be on a breathing machine.
So that's scary.
In most cases, it's another.
That is scary, and people are saying, "Well, wait a minute. I was thinking about getting that one-dose vaccine, but now I don't want to." How do you want to address that?
Well, first of all, it's very rare. These are very preliminary reports. Based on what we know so far, it occurs about 1 in every 130,000 vaccine doses. So it's really uncommon. It's something we've seen with other vaccines. With the flu vaccine, for example, it occurs about 1 in a million doses. But what people don't realize is that the flu itself causes Guillain-Barré syndrome more often than that. So we're not aware of Guillain-Barré being caused by coronavirus, but nonetheless, it's something that happens after vaccines. It shouldn't be a reason to not get vaccinated because by and large, the danger of getting coronavirus infection is much greater than your risk of getting Guillain-Barré from a vaccine. If you're worried about it, get one of the other vaccines in the meantime. But by all means, people should still get vaccinated.
Okay, so let's talk about this now. Let's talk about those who have been vaccinated. Do we need a booster? There's a lot of debate going on about this. The FDA, CDC says not yet. Pfizer says yes, it's going to be more effective. Once again, lots of confusion, causing some people to wonder, is this just Pfizer trying to make more money by pushing yet another shot so that the company benefits? What's your response to that?
Well, it might be a little of both, but I think the main thing is that right now we know that the vaccines that are out there are still effective out to 8 months after the first dose. There's evidence in both directions. There's some evidence that the vaccine might not be as effective against the Delta variant, and there's other studies that show that in fact it is effective. It's definitely not quite as effective against the Delta as it is against the UK variant or the Alpha variant, but it does work. And we actually have some other studies that suggest that we make very effective memory cells, which are cells that, remember, they've seen the spike protein. They reside in our lymph nodes. And when we're exposed to the virus again, we can very quickly ramp up production of antibodies. So that news is good news for vaccine lasting for a long time.
Okay.
Does that mean we'll never need a booster? I can't say that. I mean, the Delta variant is on the rise. There are going to be other variants, and it's possible that in the future we will need a booster. If I were a betting man, I'd say we probably will need one at some point. As of now, it's not an urgent thing.
Okay, so for now, no booster for now. Okay, let's talk about what's been going on, because all of this is happening as a new report finds an alarming increase in the number of COVID-19 cases. Take a look at these numbers that we saw. The U.S. averaged 19,455 new cases per day over the last 7 days alone. That's an almost 50% increase just from the previous week. Now, this comes from Johns Hopkins studies. Is it time to start worrying about a possible resurgence again?
Well, the other piece of information here is that 99.9% of those cases are occurring in people who haven't been vaccinated. And so that's proof positive that the vaccine works because people who are vaccinated aren't getting the infections. It's people who aren't vaccinated, and it further evidence that people who aren't vaccinated need to get vaccinated. They don't want to wait until they get this Delta variant.
Right.
Delta variant is at least 50% more contagious than the Alpha variant that we were having before. That's why it's spreading so rapidly. It's expected that by the end of August, 90% of new infections will be the Delta variant. It may be even sooner than that. It's just spreading very rapidly.
So how does this affect those who are fully vaccinated in the long run, which brings me kind of back to my question. Do we need to be worried about another resurgence in the fall if this is spreading rapidly and it's making up the majority of cases? How does this affect the majority of Americans, well, they're 50%, whatever that number is now, who are vaccinated in the long run?
For now, the people who are vaccinated don't need to worry so much because they are protected. It's the people around them who are not vaccinated who are at risk. What we do know is that the vaccines do protect you from getting sick with the Delta variant. It doesn't mean that you won't ever get the Delta variant and have maybe an asymptomatic or a mild infection. It won't land you in the doctor's office or in the hospital. But what it does mean is that people who are vaccinated might, even if they're asymptomatic, potential that they could spread the infection to others, because they might be shedding virus. So
right.
It's just critical that people who've been holding back about the vaccine drop their myths about the vaccine and just get the vaccine, get a dose.
Dr. Richard Novak with UIC, thanks so much for your time and your perspective. We appreciate you joining me this morning. Thanks again. Have a great day.